Okay, we're talking with Dr. Cory Thiele from Thiele Chiropractic. And Doctor, thanks for giving us some time this morning.
Thanks for having me. I greatly appreciate it.
So we're going to let you talk about your business, tell everybody what it's all about, how you got started, how last year went for you and that. So let's just start with how your business got started, how long you've been doing it.
I've been practicing since 2003. I knew kind of fairly early on in my collegiate career that I wanted to get into healthcare, and I wasn't exactly sure what avenue I wanted to pursue. And it wasn't until I suffered a pretty significant injury where I ended up with sciatica as a former college athlete, not being able to play any sports really at all. I went in to see a chiropractor, and it kind of really set me down that path. Graduated in 2003, started practicing initially out in the Pacific Northwest in the Vancouver, Washington, Portland, Oregon area. And then my wife and I decided to get married, and we decided if we were going to have kids, we should probably move a little closer to home so they knew their family. We ended up landing in Rockford, Illinois for a few years, practiced there, enjoyed my time there because I got to work with a lot of sports teams in the area. We worked with quite a few pro sports teams. We worked with the Chicago Blackhawks affiliate, similar to the Iowa Wild. It was the Rockford Ice Hogs. Baseball team, indoor soccer team, a couple high school teams, college wood bat baseball league team. It was kind of fun in that regard. We knew we wanted to get back to Iowa, and Des Moines was kind of an area we were looking at. And I happened to fall into an opportunity to purchase a practice that was already existing. So I purchased that practice it'll be coming up pretty quick, April 1 of 2014. So it'll be about 7 years here now in West Des Moines. Yeah.
Okay. So congratulations on that. And
Thank
tell
you.
us about who you would consider as your ideal client, patient. You mentioned working with sports teams. So is it athletes? Is it the older athlete, younger athlete? Tell us who your ideal patient is.
It's kind of a running joke in chiropractic that really anybody with a spine is a potential candidate. And we see all ranges. We see primarily most people are motivated by pain, right? So when they're coming to see you because they have a problem, it's great to get those people out of pain. Our goal is to actually talk to people about, once we get them out of pain, how you keep yourself out of pain. Nobody wants to go back there. And with our jobs and our recreation, we know our bodies are going to regress at some point, and you've just got to keep up with yourself a little bit. So we do see a lot of wellness-based patients. So they're coming in more or less to maintain their bodies and tune themselves up, as opposed to waiting for things to fall apart and then be very reactionary. We do see athletes. I used to work with the Des Moines Menace here in town for a couple of years. Still see people in the whole arena of sports, whether it's weightlifters, whether it's college athletes, whole range of people there. We'd like to see more people in a preventative maintenance format because we know people aren't in pain at that point. But that's not how, like I said, most people are motivated to come in typically in a maintenance format. We do get it every now and again. Just had a young gentleman start with me last week. He had a little bit of an advantage because his dad was a chiropractor down in the Georgia area. So he's looking for somebody to keep up with himself here. It's one of the things that you hear about chiropractic care is people always often say, well, once you go, I always hear you have to go back. And people choose to come back because they know how their body is supposed to feel. And they enjoy kind of keeping up with their body so that they don't fall apart, basically.
Yeah. Okay. So let's talk about the crazy year that was last year, 2020. And I guess the first question is, so if people couldn't be active, I mean, besides the safe health side of things, the safety side of it, how did the fact that people could not be as active, how did that affect your business and people's mentality kind of?
It certainly impacts people. Anytime you can do more on your own outside of my office, the better you're going to do, whether that's with exercise. I mean, simply just stuff like walking. You have a treadmill at home and you can get out and walk. I mean, obviously the weather as of late hasn't been too conducive for us to get outside and walk around a lot, but anything you can do outside of there, basic exercises at home, strengthening core strength is a huge one in our office. We do a lot of postural based exercises because we see a ton of people that are behind computers all day long. And now what we're finding is when people are working from home, they're realizing they really don't have a very good home office setup. I've had patients that are like, I'm working from my island on a bench seat for 8 hours a day. And I'm like, yeah, there's no wonder your body is revolting, basically. So the lack of activity, exercise, that certainly impacts people. And then just the new setups in their homes, where they maybe don't have a great computer setup, they don't have an office chair, they don't have a desk setup kind of deal. Those things all have definitely impacted through the whole pandemic.
Okay. So now let's just talk about in the business, on the business side of things that had to be changed, had to be implemented for you to keep your practice safe and to tell your patients that it was a safe place to come. Talk about that.
Right. So a lot of cleaning. We do, I have an iPad that I use at my office that actually uses a thumbprint ID, and my thumbprint doesn't work anymore because I think I use too much bleach water throughout the day. But we do, we're always wearing masks. We clean a table, we clean any touch surfaces, whether it's the ATM machine, the iPad we have people sign in on. So we wipe down in between each patient. We try to schedule our patients in a wider format so we have less crossover or potential for crossover. So the hope is, the way I schedule things, we have one patient in the office at a time, and that patient is gone before the next patient comes in. It's more me waiting on patients than anything else. It doesn't always work out like we planned. Some people come early, some people come late. So it kind of, sometimes you can run crossover. We found that our patients are really good about keeping that social distance when there is more than one patient in the office. But yeah, excessive amounts of cleaning, mask wearing, all that fun stuff that I think most every business is now having to do. And then just in trying to just manage our time slots a little bit more efficiently. It makes for a longer day for me potentially. But you know, in the name of safety, we try to just make sure we have the ample time to do all the cleanup and get somebody out before the next patient potentially comes in.
Okay. Were you one of the industries that got closed down for a while, or
no? In the medical world, we're considered an essential service. You know, a chiropractor's in this window. Our job is, if we can keep more people out of an urgent care clinic or an emergency room, it's what they want. You know, the last place you want to be right now is a hospital system. If you don't have to be there, absolutely. So the more people we can keep out from, you know, massive headache issues where they have to go in for pain relieving meds, low back issues, which is one of the highest things that they see in healthcare typically, is things associated with low back pain. If we can manage those people more effectively where they can stay out of that system, then that's why we're considered an essential service, basically.
Yeah, good point. Excellent. Okay. So there's a saying out there that a smart person learns from their mistakes, a wise person learns from other people's mistakes. So you've been in business a while now, and for those people that are going to be watching this and listen to this, what words of wisdom do you have for them, that maybe some lessons that you've learned or mistakes that you've made along the way that you can give them for pointers or for tips?
Yeah, I'm sure there's plenty of mistakes. Trying to figure them out is always the fun part. You know, I think the best thing in any business is creating a relationship where there's an element of that trust factor. It doesn't matter if you're a chiropractor, if you're an auto mechanic. Once you establish trust with people and they know that they can come to you and count on good advice, you're going to be in good shape. I think that tends to propagate itself, and it's word of mouth. You know, I have patients that come into my office, and I just had a young lady call me today, and for a new patient appointment tomorrow. And I was walking through what she has going on, and I'd asked her if she had ran down the medical route, because what she has going on sounds pretty severe. And, you know, I told her, I said, we'll give this an effort and we'll see if you start to show some response, but there's always the probability you have a major disc problem because of some of the symptomatology she has, and we may need to get you in for an MRI. So I think things like that, I don't have to be your savior. I just have to find the guy that can get you helped the right way. And if I'm not the guy, I want to find the person that can for you, basically. So I think that element of trust, people can know they can come to me for good advice, whether it's me fixing it or getting them sent to the right person. I think those things all pay off. And again, that's, I think, any industry, right? You look for an auto mechanic and you want to see a guy that's like, I know I'm going to go in there, he's going to tell me what my problem is and not overcharge me, or, you know, whatever else it might be. That's a huge factor. And that's something I've prided myself on our office as well.
Very good. Very good. So last question, and then I'm going to let you off the hook and let you get back to work. But
Awesome.
Tell me about something tell me what inspires you.
You know, the thing that I like to see, and the reason I got into the profession that I got into is, again, when I had my injury, I was absolutely floored at how fast the response was and how much difference it made. And we did it in a way that didn't require me to actually medicate myself or a surgical intervention. Now, that's not always the case, right? There are some people when they come in, there are times and places where I'll send people for medications when they're that bad. There are people that potentially have to have a surgical intervention. My goal is to keep as many people away from that as humanly possible so that they can actually enjoy and function in their life the way they want to. I don't think you function as well as you should function if you're medicated all the time. Medications are there for like in emergent situations. We hope that people can stay away from those lifestyle type of drugs if they can work on functioning, how their body functions and how they take care of their body, whether it's chiropractic care, exercise, diet management, things along that line, so that they get the right nutrients and they're putting the right stuff into their body so that they get the most out of their body, basically. So really, for me, my motivation is always trying to help people live a life that they want to be able to live. It always stinks to hear somebody say, well, I can't do these things anymore because I have to consider what that's going to do to my body if I try it. I don't like to hear that, no matter what age my patients are. I have a guy, gosh, what is he now? He's got to be up in his upper 80s. He plays in a competitive men's softball league. And he travels around with these guys, and it's unbelievable. He competes in the Iowa games when they're actually on. This last year is obviously an exception. And this guy, I think he has something like 19 or 20 gold medals in events that he does. And I'm like, this is what I'd like for all of my patients who get to 60, 70, 80 years old, that they can still do the things that they want to do and enjoy life.
Well, that's awesome. Dr. Thiele, thank you for your time. And I hope your practice, I hope you have a great year this year. So thank you very much.
I greatly appreciate it. Yeah, thanks for considering me, and thank you for the good wishes. I appreciate it.